When should someone get pregnant after having an abortion or a miscarriage? I mean, when can someone conceive after getting a miscarriage? This question bothers very many women out there, and in this video, we'd like to explain to get you know the right time to conceive or the right time to get pregnant after a miscarriage. Follow me.
Ask Dr. Uthuman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthuman YouTube channel, a channel where you learn medicine at the comfort of your living room. I know it's been so long when I am out of your sight. There has been a lot of things going on, and I also know that there are those people that made appointments and I couldn't answer them. My accounts had been hacked, but currently very much restored, and therefore if you'd like to get in touch with me, if you'd like to have a private chat, a private conversation with me, go to my website www.druthuman.com, follow the proceedings. You'll be able to chat with me privately and you get your question answered very well. Now today we have a very sensitive topic also, and there is a question which is coming from Rachel Kelly. She's saying, hey doc, thanks so much for your programs. I would like to know when I can conceive after having an abortion. I had an abortion 2 weeks ago and I am wondering when I can conceive again. This question is very important and I know it will help most of us there. Now, let's first understand what's an abortion or what's a miscarriage. An abortion is when there is pregnancy loss before viability. What do we mean by viability? WHO defines viability as any pregnancy loss before 20 weeks of amenorrhea or before 500 grams. What do we mean by 500 grams? 500 grams of the fetus. Now, before 20 weeks of amenorrhea, if you get any delivery there, if there is loss of the pregnancy before 20 weeks of amenorrhea, we call that an abortion or a miscarriage. Now, when to call it an abortion or a miscarriage, I think it depends on many, because these words are synonymous, but most people feel like it becomes an abortion when it's you who has initiated it. That's what most people feel. And they also think that it becomes a miscarriage when it has happened on its own. However, these words can be used interchangeably. And therefore, we shall define, for the context of this video, we shall define a miscarriage stroke an abortion as a pregnancy loss before viability, or i.e. before 20 weeks of amenorrhea, or before a half of a kilogram. So if the fetus is still below 0.5 kilograms, we call that a miscarriage or an abortion. Now, when you want to answer, when you want to understand when to conceive or when to get pregnant again after having this miscarriage, there are questions that should linger into your mind. Number one, my viewer, you need to understand the age of the fetus at the time of the loss. How many weeks of amenorrhea did my baby have before getting a miscarriage? Was it 12 weeks, 1 week, or 4 weeks? That will determine when to conceive again. Then secondly, we must understand what caused this. What caused this? Before you even think about conceiving again, please take time and find out why the miscarriage happened. Why do you want to know why the miscarriage happened? Because you don't want it to happen again. Actually, you know there are many people who are having recurrent miscarriages. You get pregnant today, you get the loss after 3 weeks, you conceive again, you get a loss, you conceive again, you get a loss. You find someone telling you, I have had 4 consecutive miscarriages. And why is this person really trying to conceive again before they get to know what caused the miscarriage? So I would advise that get to know first what caused your miscarriage. And how will you know it? By doing tests. You can do various tests. You can do ultrasound scans. You can do fertility hormonal assay, those fertility tests. You can do hormonal tests, I mean. You can do MRIs. You can do several tests, including the blood grouping and the rhesus factor. Because in one of my videos, I told you that one of the major causes of miscarriages or abortions is blood group or rhesus factor incompatibility, whereby the mother or the female has rhesus factor negative and the male has rhesus factor positive. You expect an abortion on the second born. So you need to first identify the cause of this miscarriage. Then also the question that should come into your mind is, how did I manage my miscarriage? This is very important. Someone gets a miscarriage. You've been pregnant, you lose the baby. And then you just keep quiet. You just leave it like that. You don't go to the hospital because you saw blood and then someone told you, you've lost the pregnancy. You don't go to the hospital, or even going to the hospital and someone just is asking you, are you still seeing blood? No. Okay, if you're no longer seeing blood, you can go home. How have you managed the complications? You've had a miscarriage, go to the hospital. Confirm that everything is out. Do an ultrasound scan to confirm that there are no retained products of conception. When an ultrasound scan is done, the sonographer or the radiographer, all that imaging technologist will look into the uterus very well. Find out whether there are clots. Find out whether there are any parts of the fetus that have remained in the uterus. And if there is any part that has remained in the uterus, it must be removed. So you have to see the doctor to remove them, either medically by giving you some tablets or by doing manual evacuation, or what some people call dilatation and curettage. Manual vacuum aspiration. All those procedures can be done to remove the retained products of conception. So when you get a miscarriage, when you get an abortion, try to make sure that everything has been removed. Also, as we are talking about the complications, someone may have a serious hemorrhage. There is too much bleeding. So we have to look at all that in order to determine when to conceive again. So when it comes to when to conceive again, I must be very sincere with you that there is no direct cut. There is no direct answer to that, because science has really tried to do very many studies, and I'll pass you through these studies. Most studies actually that have been done are saying that someone should conceive within 1 to 3 months. That's what they are saying. Most of the studies, they are saying 1 to 3 months. However, the American College of Obstetricians and Gynecologists says someone can conceive within 2 weeks. So after having a miscarriage, 2 weeks after, it's okay. They are saying, for the Americans, as they say, you can conceive. It's okay, you can conceive. And actually, they have their reasons, because they have done some studies. And then we have the recommendation from the Federation of International Gynecologists and Obstetrics Association, and that is the FIGO. FIGO says someone should conceive within 6 weeks. The Americans are saying someone can conceive after 2 weeks. And then FIGO, the international body, Federation of International Gynecologists and Obstetricians, it is saying after 6 weeks. And now, the WHO, this is the body that we are all following, says someone should conceive after 6 months. 6 months. Someone should conceive within 6 months. That is what the World Health Organization says. Now, this is going to confuse you. I must say it also confuses us as medics, because we have different recommendations from different bodies that are reputable. Now, what are we going to do? We want to look at the following researches which were done. There is a meta-analysis which was done, and it was done to assess the outcome, because what WHO says about the 6 months, it wants someone to have a good results after conception. In other words, for them, they feel like if you delay conception, the outcomes will be better. the outcomes will be good. Now, these people did a research. It was a meta-analysis to identify, because they had women who conceived after 6 months. They had women who conceived immediately. They had women who conceived at different times. But now when they did this analysis, it found out that the outcome, the pregnancy outcome, was not associated with the timing. So waiting, in their recommendations, they're saying waiting to conceive after a miscarriage has nothing to do with science. Am I confusing you? There is another study which was done by Karen C. Schelp and others. And this study was published in the National Library of Medicine. What did it say? Actually, it was looking at the association. It looked at couples that conceived, because the first study in the meta-analysis, we looked at couples that conceived in the 6-month period we talked about. That is the WHO recommendation. Now, this one of Karen C. and others, which was published in the National Library of Medicine, looked at the 3-month. It was looking at the outcomes of when someone conceives after 3 months. What are the outcomes? Does the pregnancy stay there, or they still have more miscarriages? They found that there was no difference. So the outcomes were okay. In other words, there was no difference in the control group and the group which was conceiving after 3 months. So their recommendation, we are talking about Karen C. Schelp and others. They are recommending that it's okay, you can conceive immediately. Now, what is Dr. Uthuman saying? Because we have recommendations from all these people. Now, this is what I will say. When you get a miscarriage, first make sure that you know what has caused your miscarriage. Learn, understand what is causing this miscarriage. How are you going to know? Go to the hospital and run tests. Identify the causes of the miscarriage. So, when to conceive again will depend on, number 1, the cause of the miscarriage. Number 2, was there complications after the miscarriage? Because, for example, if you've had a miscarriage and then there are retained products of conception, after maybe 2 weeks, you're seeing there are still retained products of conception. You've gone to the hospital, they have done a D&C, you've lost a lot of blood. Of course, we can't recommend you to conceive immediately. So we may tell you to delay conception. So it will depend on the complications of this miscarriage or the complications of the abortion. It will also depend on the other underlying medical illnesses. For example, someone may be having an immunological disorder. Someone may be having polycystic ovarian syndrome, and probably it is the PCOS or the polycystic ovarian syndrome that caused this miscarriage. Someone may be having a thyroid disorder. You may be having a uterine abnormality. So what are we saying? First treat. First make sure that these medical illnesses, which might have probably, you may find that these are the illnesses that caused the miscarriage. First treat them before we consider conception. Now, we also say that first recover, and I need to first recover emotionally and physically. Let me tell you, when someone gets a miscarriage, except when they have been badly wanting this baby, they get tortured psychologically. They get tortured physically. And therefore, we would, my recommendation is that first recover. First have that emotional stress lowered. Get physically okay. And then think about conception. And lastly, what I would say is that first allow to get menstruation. What am I meaning? If you've had a miscarriage today, and you've recovered from the miscarriage very well, you've done complications and managed, everything is okay, first allow to see at least one menstrual cycle. First bleed again normally, the normal menstrual cycle. First have at least one and conceive. Why am I saying so? If you've had a miscarriage today, and then in 2 weeks you conceive, if you get any bleeding in between there after these 2 weeks, you may not know whether the bleeding is as a result of the other first miscarriage you had. It's a complication. Maybe there are still other retained products, or it's another miscarriage. I don't know if you're getting me. You had a miscarriage, and then after 2 weeks, you've conceived. If you bleed after a week or after 3 weeks, you may not know, we may not be very sure whether this bleeding is as a result of the current pregnancy that you're having a miscarriage again, or it's a continuation of the other miscarriage. We may not be sure. And that will be determined by, again, going to the hospital, doing an ultrasound scan, studying again to find out if this is another fetus, the current fetus, or it's the products of conception that were aborted or miscarried in the previous time. So my advice would be that first wait to see a normal menstrual cycle, at least see a single period, and then you can now try to conceive. And lastly, please, this is the take home for everyone. Make sure that you identify the cause of the miscarriage. Because in most cases, that cause will also cause another miscarriage. It may also lead to another miscarriage. If you have UTIs, you have infections, you have PIDs, you have syphilis and so on, first treat them so that you can have another healthy pregnancy, giving birth to a healthy baby. If you've not yet subscribed to my YouTube channel, please go on and subscribe, and also press the notification bell in order to be notified of any video I upload. And also, if you'd like to get in touch with me to have a private chat, go to my website www.druthman.com. Ask whatever you want. We shall have a chat one-on-one, and you get your problem solved. My website is currently active and it's been restored. Sign out.
Ask Dr. Uthuman on Masawa Wall.